Alright, hello again, my ANORBF laboratory class. Yes, so this is the last, type of sediment that we will be discussing as part of our microscopic analysis. Okay, so hopefully matapos ko siya sa isang video lang. Okay, so yan, wish me luck. Alright, so katulad nga ng sinabi ko, your sediments, they are generally classified as organized and unorganized sediments. Okay? So para sa ating mga unorganized sediments, isa lang po yan. At yun ang ating mga crystals. Okay? So before we move on to the different crystals, let us try to consider the different factors that affect the precipitation of your crystals. Okay? So tatlo lang yan. And I think nasa module naman po natin ito. Okay, so just take down the necessary explanation or additional information that I will be providing. Okay, so una, ayan, let us consider ano yung mga factors which would affect, okay, the formation of your crystals. Okay, so number one, una dyan, we have your temperature. Okay, so temperature class, in particular, we are considering low temperature. Okay, so ibig sabihin, pag low temperature ang pinag-uusapan natin, ang temperature, it will, facilitate the crystallization of your substances in vitro. Diba? In vitro po ang kino-consider natin dito. Kasi take note, iisa lang naman lagi ang temperature ng katawan, di ba? So, 37 degrees Celsius lang naman yan lagi. And so, your temperature, this is a factor which governs, or which predominates the crystallization of your substances in vitro. Okay, so again, we are considering low temperature. So that's why if you are going to compare a freshly voided urine to your refrigerated urine or to a urine sample which has been allowed to sit or to stand at room temperature for several hours, alin ang merong mas maraming crystals? Siyempre, yung refrigerated urine or yung urine which has been allowed to stand at room temperature for several hours. Kasi mas mababa. Yung room temperature, mas mababa lalo ang ref temperature. Okay? So ilagay ko lang ha. This is, your crystals rather, are more observable in refrigerated, refrigerated urine or urine which was allowed to stand or urine allowed to stand at room temperature for several hours. Okay? Yan. So that is the first factor that we have to consider. Kaya nga 'di ba, doon sa ating recommended sample for your microscopic examination, ano ang recommended? Fresh. Okay? Kasi one of the reasons why refrigerated urine sample is not the recommended sample is because of the fact that it will promote, the precipitation of your amorphous and your crystalline materials. Okay, so balikan lang natin yung introduction na diniscuss natin when it comes to your microscopic analysis. Okay, so the problem if, for example, merong mga crystals na nag-precipitate due to a low temperature, so take note that these crystals will obscure, clinically significant sediments. So sa sobrang dami niya, doon sa ating refrigerated urine or doon sa ating prolonged standing urine, pwedeng matakpan, di ba? Yun ang ibig sabihin ng obscure. Pwede po niyang matakpan matakpan yung mga clinically significant na sediments. Okay? So yun yung problema dito. Alright? So another factor that we have to consider in the formation of your crystals would be your solute concentration. Okay? So yan yung isang factor. So we have solute concentration. Because remember that, ano ba ang na-form na crystals? Remember na ang crystals galing yan sa mga solutes which are present in your filtrate or in your urine. Okay? So when it comes to solute concentration, this is the predominating factor that we consider in vivo. Okay? So predominating factor that we are considering in vivo crystallization. Okay? So ibig sabihin, crystallization of substances or solutes inside the body. Alright? So in particular, class, baka naman pwede ko nang erasein ito kasi alam nyo na, wala na akong space. Okay, ayan, in-erase ko na. Alright. So, in particular, ano ang kino-consider natin when it comes to your solute concentration? So, kung sa temperature, low temperature ang kino-consider natin, sa solute concentration, ang kino-consider natin ay increased solute concentration. Okay, so balikan ninyo yung knowledge na nakuha natin sa biochemistry or even in your MCHOC. Okay, remember na ang mga crystals or ang mga solutes rather, they have a decreased ability to remain in the solution pag mataas ang solute concentration. Diba? Yes. Yan nga yung, excited na naman si Ma'am mag-share. Yes, super excited na naman ako. Okay. Yan nga yung principle ng saturation. Diba? Saturation of a particular solution, saturation, oversaturation or supersaturation of your solution. So, kailangan lagyan mo siya ng lagyan ng maraming solutes para mag-crystallize. Diba? Because again, increased solute concentration decreases the ability of substances, okay, of solutes, ilagay ko na lang, okay, of solutes to remain in the solution. Okay, ayan, yes. So if it decreases the ability of your solutes to remain in the solution, ibig sabihin magkakaroon ng crystal formation. Alright, ayan, alright. So take note also that in the case of solute concentration, kasi nandito na din tayo, okay? So crystals, ano ang pwede nating i-correlate when it comes to the presence of crystals in fresh, okay, in freshly voided urine. Alright, so since solute concentration ang pinag-uusapan, class, anong parameter, okay, allows us to determine the solute concentration that is present in your urine sample? Anong parameter ulit yon? Okay, very good. Yes. So we have your specific gravity. Okay? So ibig sabihin, class, pagkatingin mo sa microscope at marami kang nakitang crystals, tignan mo yung specific gravity na nakuha mo during your reagent strip testing. Okay? Kasi pag may crystals kang nakita, marami kang crystals na nakita, it follows na mataas ang specific gravity ng urine sample mo. Alright, ayan. So that is another factor that we have to consider. We have your solute concentration. Okay? So another factor na dapat nating i-consider would be your pH. Okay? So take note that there are several solutes which might be present in your filtrate or in your urine, okay, which are capable of crystallization. Okay, so based on the pH of your filtrate or your urine, we can categorize or we are able to know what kind of substances are capable of crystallization. Okay, so in particular, when we consider your organic, okay, and iatrogenic compounds or substances or solutes, so they precipitate at an acidic pH. Okay, so nagpre-precipitate sila sa acidic na pH. Alright, so class, are we familiar with the term iatrogenic? So pag sinabi po nating iatrogenic, these are compounds or substances which have been administered to us as part of medical therapy, okay? So as part of treatment, as part of testing, as part of monitoring a patient's condition. Okay? So kasali sa iatrogenic compounds na yan yung mga medicines, okay? Or drugs na ina-administer sa atin. Okay, medications, iatrogenic compounds. All right? So if we consider naman the crystallization of your inorganic compounds or inorganic solutes, so they crystallize in neutral and alkaline pH. Okay? So ito po yung general rule when it comes to the crystallization of your substances at certain pH levels. Alright, so those are the different factors that we have to consider in the crystallization of your solutes or your substances. Okay? So next, punta naman po tayo. Yes, punta naman po tayo sa, so na-explain ko na tong una ha. So crystals, precipitation of your urine solutes. So they may be in the form of your inorganic salts, your organic compounds, or your medications, otherwise referred to as your iatrogenic compounds. Okay? So when it comes to the identification, ayan, so paano natin ina-identify yung ating mga crystals? So the most valuable parameter, okay, or characteristic that we have to consider is the pH. Okay, so nakalagay dyan, pH. So this is the most valuable parameter in the identification of your crystals. Okay, so your pH actually determines what chemical, okay, or what solute will precipitate in your urine. Okay, so ano ba yan? Okay, so that is one parameter that we have to consider, or one technique that we have to consider. Another is, of course, the morphology and color of your crystals. Okay, so some crystals, actually all of them have unique appearance. They have unique morphologies, they have unique appearances under the microscope. Okay, and apart from that, the color of your crystal will also tell us what kind of crystal are we looking at. Okay, so iba-iba po sila ng description na ginagamit. So we will be discussing that as we go along the different crystals which may be present in your urine sample. Okay, another, we have the use of your polarizing microscope. Okay? So, again, pag sinabi nating polarizing microscope, okay, medyo, usually kasi, ang ina-associate natin sa polarizing microscope are, of course, your cholesterol, di ba? Cholesterol substance. However, take note that your polarizing microscope, in addition to of course your cholesterol confirmation, we can also use it in order to determine the birefringence, okay, birefringence characteristic of your crystals. Alright, so yan, so yon, okay? So birefringence characteristics of your crystals. So merong mga crystals ang birefringent, okay, moderately birefringent, strongly birefringent, so on and so forth. And it helps us, especially kung kunwari man na may mga crystals na magkakamukha. Okay, so to differentiate similar looking crystal, okay, similar looking crystals, we can make use of your polarizing microscope. Okay, and then lastly, we can also resort to solubility, the solubility characteristics of your crystals. Okay? So again, in instances when you are not sure of the identity of a particular crystal, so pwede din nating basis ang solubility characteristics. Okay? So these are the different parameters or the different techniques that we can utilize or perform in the laboratory in order for us to identify our crystals. Alright? So yan. Okay. Alright, so yan. So may I just also emphasize on your calcium oxalate, okay? So your calcium oxalate, ayan, although in general talaga, we follow the rules on the crystallization of your solutes based on the pH of your filtrate, okay? Ito ang exception. Ayan. Why? Because take note that your calcium oxalate, it has the ability to precipitate in both your acidic and your alkaline urine. Okay, ayan. Alright. So now, let us move on to the different crystals which might be present in your urine sample. So ano-ano yung mga crystals na yan? Okay, so first, we consider the normal crystals in acidic urine. Okay, so in your acidic urine. So first, we have your amorphous urate, uric acid, calcium oxalate, monosodium urate, and acid urate. Ano ang napansin natin, class? Okay, very good. Alright, so basta po may urate at saka, yes, urate. And then we have your uric acid also. Okay? Sa acid po yan. Okay? So basta nakakita ka ng urate, uric acid, sa acid po yan. So urates precipitate in acidic urine. Yung isa namang rule natin in general, okay, phosphates naman precipitate in your alkaline urine para hindi po tayo mahirapang mag-memorize. So urate, acidic, phosphates naman ay sa ating alkaline urine. Okay? Ayan. So the first crystal that we will be discussing is your amorphous urate. Okay? So take note that your amorphous urate and your amorphous phosphate, they look the same under the microscope. Okay? So that is your amorphous urate microscopically. Ayan. Iba kasi po ang itsura niya microscopically at saka microscopically at saka macroscopically. Okay? So microscopically, so they appear as yellow-brown, okay, yellow-brown granules. Ayan. So they appear as yellow-brown granules and they usually precipitate at a pH, yes, a pH that is greater than or equal to 5.5. Pero pasok pa din siya sa acidic. Okay? So pH that is greater than or equal to 5.5. Alright, so yun po. It is important for us to mention yung pH at which your amorphous urate precipitates in order for us also to differentiate it from your uric acid. Although, under the microscope naman, magkaiba sila ng itsura. Okay? So, pag amorphous urates, yes, tama, urates, the pH should be equal or greater than 5.5. Okay? Pero pasok pa din siya sa acidic. Pag uric acid kasi, class, okay, uric acid usually precipitates at a lower pH. Okay? So, ibig sabihin, lower than the pH that is required for the precipitation of your amorphous urate. Okay? So, microscopically, ganyan po ang kanyang itsura. However, paki-ano na lang ha. Yes, paki-take note na lang kasi baka malito kayo dito sa aking PowerPoint. Okay, so yellow-brown granules, yan yung microscopic appearance niya. Okay? And then, yung brick dust, Bakit ko ba nailagay yan dyan? Okay, i-relate na lang natin siya dito, pag-isahin na lang natin siya dito. Okay, so pink brick dust precipitate, this is naman the macroscopic, okay, macroscopic appearance of your amorphous urate. And your pink brick dust precipitate, this is distinct, even more distinct upon refrigeration. So take note, ano na ulit yung pigment which has a high affinity to your amorphous urate? Anong pigment na naman yon? Yes, very good. We have the pigment uroerythrin. Alright, yan. So take note that your uroerythrin, this is a pink pigment that has a high affinity to your amorphous urates. So ibig sabihin, dumidikit po sila sa ating amorphous urate. And when your amorphous urate precipitates during refrigeration, makikita mo talaga na pink brick dust precipitate. Okay, pink brick dust precipitate yung appearance po niya. Okay, ayan. So take note also that your amorphous urate, it may form clumps, okay, or it may adhere to fibers which are present in your urine sample. They may also adhere to your mucous threads. Okay, kaya kung magma-microscopic examination ka, hanapin mo yung mga mucous threads kasi there is a higher likelihood na nakadikit sa kanila yung mga amorphous urates natin. Okay, yes. So another characteristics or other characteristics of your amorphous urate, so take note that they can be converted to uric acid with the addition of your concentrated hydrochloric acid. Okay? And when it comes naman to its solubility characteristics, so nabanggit na natin ito doon sa ating causes of turbidity, di ba? So take note that your amorphous urate, this is dissolved by heat or by warming and by the addition of sodium hydroxide or any dilute, okay, any dilute alkali for that matter. Okay, so yan. So those are the things that you have to remember for your amorphous urate. So ano ang itsura niya? Okay, pag nasa urine sample. So luckily, naka-encounter kami ng ganyan kasi last week, yes, syempre super toxic sa laboratory, ang daming pasyente. Sumama pa ang mga nursing students na mag-face-to-face din. So nagpa-medical din sila. And so, ayan, yung ibang mga samples, ni-refrigerate muna namin kasi, yun nga, ang dami. Tapos ilan lang kami. Ilan lang kami sa lab. Okay, 5 lang kami. Okay, ayan. So, since hindi namin ma-perform agad-agad yung microscopic microscopic analysis ng ating urine, yung iba ni-refrigerate muna namin. Okay, o tignan nyo nga yung lab number dyan, 50, 56. Okay, iyak ka na lang. Charot. Iyak na lang kami sa lab pag ganyan kadami ang mga pasyente. Alright, so yan. Kinompare namin yung itsura ng urine sample na merong amorphous urate at saka walang amorphous urate. Okay, so dito, ito yung may amorphous urate. Okay, so nakita mo dyan, pink brick dust precipitate. So actually, yung pagka-pink niya, mas noticeable siya, okay? Mas distinct siya after centrifugation. O yan, o, di ba? Pink, ang cute, as in, ang cute niya. Talagang, ang cute talaga. Okay, ang ganda niya in person. Okay, ikaw, maganda ka ba in person? Oo naman, lahat tayo maganda in person. Okay, so makikita mo yan, pink talaga siya, as in, it's pink. Sa mga mahilig ng pink na color dyan, ang cute niya, promise. pastel pink yung color niya, okay, after centrifugation. Okay, so yan yung tinatawag natin na pink brick dust precipitate, which is more distinct after centrifugation and after you have decanted already the supernatant. Okay, so yan, di ba? Ang ganda. Alright, so next, ano naman ang itsura niya under the microscope? So yun yung macroscopic appearance niya. Under the microscope, ganito siya. Okay, so if you can still remember dun sa video na binigay namin ni Sir Ruben, sabi niya, di ba, sometimes pwedeng mapagkamalan na bacteria ang amorphous urate. Okay, so if I'm not mistaken, nabanggit niya na in order to differentiate your amorphous urate, okay, your amorphous urate o from your bacteria, yung bacteria natin ay gumagalaw. Kasi sometimes medyo parehas sila ng shape ng morphology, okay? And so, ang basis natin doon ay yung movement ng ating bacteria, okay? So, of course, si amorphous urate, hindi siya gumagalaw. Si bacteria, gumagalaw po sila. Okay? Ang cute nila, nagtatumbling-tumbling doon sa ating urine sample. Alright? So, that is for your amorphous urate. Okay? So, next, we have your uric acid. So just like what I have mentioned, your uric acid, so it needs a lower pH. Actually, si Susan Strassenger, nabanggit lang niya na hindi siya nagbigay ng specific na range when it comes to the pH. Nabanggit lang niya na as compared to your amorphous urate, okay, your uric acid needs a lower pH in order for it to crystallize or in order for it to form. Okay, but in one of the references that I read, okay, nagbigay sila ng pH and that is 5 to 5.5. Okay, so lagi lang nating isipin na si uric acid ay kailangan ng mas mababang pH as compared to your amorphous urates. Okay? So yan. So how does your uric acid appear under the microscope? So they appear as yellow-brown crystals under the microscope. Okay? And take note na aside from yellow-brown, other colors which have been associated to your uric acid, we have yellow, okay, or pwede din po na reddish-brown. Okay, so yellow, brown, yellow, or reddish-brown. So it is soluble in alkali and it is the crystal that assumes the greatest variety of shapes. So, ibig sabihin, hindi lang iisa ang itsura ni uric acid. Marami po siyang iba't ibang itsura. So, what are the different shapes, okay, which are used in order to characterize the appearance of your uric acid? So, first we have rhombic. So, pwede pong rhombic sila. They may appear as whetstones. Okay, they may have a whetstone appearance. They may have a rosette appearance. Okay, they may appear as wedges. They may appear as squares. Okay, or they may appear as cubic. Yes, or they may have a shape of barrels. O, ang dami no, class. Okay? So, marami po talaga siyang morphology. In particular, yung shapes niya or yung itsura niya. They may appear as barrels. Okay? They may also appear as oval forms with pointed ends. Okay? So, these are the different appearances. Lagay ko na lang dito These are the different appearances or morphologies of your uric acid. So in particular, I want you to, kasi favorite nila ito sa board exam, o di ba? Isang taon na lang magbo-board exam na din kayo. Okay? So in particular, ang natanong na sa board exam ay yung barrels at saka oval forms with pointed ends. Okay? So another description which they provided doon sa ating oval forms with pointed ends, okay, so lemon shaped. Okay, so yan, kung makita mo lemon shaped crystals, naku, uric acid na yan. Okay, yan, so uric acid po. Dito na lang, class, ha. Alright, so ganyan. Okay? The problem with your uric acid is that it resembles your cysteine. So yun yung problema dyan. So it resembles your cysteine, okay? In order to differentiate your uric acid from your cysteine crystal, okay, so you can use your polarizing microscope. So the characteristic birefringence of your uric acid in your polarizing microscope is that it has a strong birefringence. Okay, so strong birefringence po siya. So this will now distinguish your uric acid from your cysteine. Okay, so what are the different conditions which are associated with increased amounts of uric acid? Okay, so take note ha class na 'di ba ang nakalagay normal crystals in acidic urine. So that means their presence does not correspond automatically to a pathologic condition. Okay? Syempre, yung doktor ang magsasabi kung pathologic ba yung presence ng uric acid or not. Kasi pwedeng normal lang naman na meron kang uric acid doon sa ating urine sample. Okay? However, there are certain conditions which will facilitate, the crystallization of your uric acid. Thus, they are present in high numbers in these conditions. Okay, so ano yung mga conditions na yan? We have gout, chemotherapy, and your Lesch-Nyhan syndrome. Okay, so if we are going to go back to the formation of the substance uric acid in the body, remember na galing sila, 'di ba? They are products of the metabolism of your purine. Okay, 'di ba? They are products of the metabolism of your purine. Saan natin nakikita ang purine? So remember, nakikita po 'yan sa ating nucleic acids. Okay, nucleic acids. All right. So, kailan nagkakaroon ng increase in nucleic acid sa katawan natin? If there is an increase, 'di ba? So, increase in nucleic acid, so this is a result of an increase in cell turnover. So, ibig sabihin, maraming cells ang namamatay. Okay? So, maraming cells ang namamatay talaga. Okay? Maraming cells ang nasisira, namamatay. Okay? Just like in the case of your chemotherapy. Okay, 'di ba in chemotherapy, your cancer cells are destroyed, and in addition to your cancer cells, since hindi naman very specific ang ating chemotherapy, so masisira or madedestroy din yung mga normal cells natin. Okay, so any condition which will or which causes an increase in cell turnover, so this will also increase your nucleic acids available for metabolism, and one of the components of your nucleic acids, we have your purines, and of course from your purines your uric acid will be formed. Okay, so yan. All right, so those are the things that we have to remember when it comes to your uric acid. Okay, so soluble in alkali. Yes, soluble in alkali. It will not dissolve in the presence of your acetic acid or your acids in general. Okay? So yan. Alright, so ano ang itsura ng ating uric acid under the microscope? So sabi ko nga, iba-iba. Alright, ayan. Yes. So these are basically cysteine-like looking uric acids. So mamaya ipapakita ko sa inyo kung anong itsura ng uric acid, okay? And apart from that, if you're going to look at it, may mga oval forms tayo na merong pointed, 'di ba? Pointed ends. Thus, kung titingnan mo, medyo mukha nga naman siyang lemon, 'di ba? Okay, under the microscope, okay? So in addition to that, so your uric acid may also have other forms. Okay, like for example, ito rosette forms, okay, cubic forms, ayan, so rhombic forms, so on and so forth. All right, so these are all your uric acids. Okay? Ayan. Next, we have your calcium oxalate. Okay, yan. So your calcium oxalate class, yes, it may be color, sorry, ayan. Okay, upo lang ako ng maayos. Okay? So, it appears colorless under the microscope, and take note that your calcium oxalate is soluble in hydrochloric acid but not in acetic acid. Okay, so soluble in hydrochloric acid but not in acetic acid. Okay, so there are two forms of calcium oxalate. Ayan, so there are two forms of calcium oxalate. So we have the dihydrate form. Okay, so meron tayo yung dihydrate form, and then we also have your monohydrate form. So depending on whether we are talking about your dihydrate calcium oxalate or monohydrate calcium oxalate, magkaiba yung trivial name, okay, na meron po sila. Alright, so dihydrate calcium oxalate is otherwise referred to as your Wedelite. Ayan, so pakibilugan ang letter D kasi that will help you memorize it easily. So dihydrate, okay, Wedelite, yan. And your dihydrate calcium oxalate have the following morphologies. So they may be octahedral or envelope shape. Ito very common itong envelope shape ng calcium oxalate. Lagi naming nakikita yan under the microscope. Okay? And apart from that, the birefringence of your Wedelite or your dihydrate calcium oxalate is weak to moderate. Okay? Under your polarizing microscope. Alright, so in contrast, the other form of your calcium oxalate is your monohydrate, otherwise referred to as your Wewe-lite. Okay, so para naman mas madali kong minememorize ito, baliktarin mo lang yung letter M, magiging W, kaya Wewe-lite. Okay, o diba? Ayan, ano ba naman yung mga palatandaan mo, madam? O bahala ka, gagamitin mo din lang naman sa exam. Okay, so yan, monohydrate or Wewe-lite. Okay, so ito naman, iba yung itsura niya under the microscope. It has a dumbbell or an ovoid shape under the microscope. Okay, and it has a strong birefringence as compared to the weak to moderate birefringence of your dihydrate. Okay, so between the two, between your dihydrate and your monohydrate, your dihydrate class, so this is more common as compared to your monohydrate. Okay, yes, as compared to your monohydrate. Okay, so the appearance of your calcium oxalate in urine, it has been associated with the ingestion of foods which are high in oxalic acid. So when oxalic acid becomes present in your urine sample, this is referred to as your oxaluria. Okay, so ibig sabihin mataas yung oxalic acids na present doon sa ating urine sample. Okay, so increase in oxalate absorption, yes, due to the ingestion of your of foods rather which are high in oxalic acid. So again, so kung may increase in absorption in your intestines, so they will become available in the circulation and they will be excreted out as part of your urine. All right, so yan. So what are examples, class, of foods which are high in oxalic acid? So we have your tomatoes, okay, asparagus, and the vitamin ascorbic acid. Okay, ayan. So ascorbic acid po. Okay, so tomatoes, asparagus, and your ascorbic acid. Okay? Alright, so yan. And then, take note, yes, take note naman, ito in general ito ha, ayan. But usually, ang nakikita natin na type ng CAOX ay yung dihydrate form. Okay, sila yung usually na na-form as a consequence of oxaluria. Okay, all right. So, another thing that you have to consider naman when it comes to your monohydrate. So, yung sa monohydrate naman natin, class, so the presence of monohydrate calcium oxalate, so this has been associated with ethylene glycol poisoning. Okay, so I repeat, it has been yes, it has been associated with ethylene glycol poisoning. So ano ulit ang ethylene glycol? This is an antifreeze substance. Okay, this is an antifreeze substance or antifreeze agent. And usually the morphology that is associated or the specific morphology of your monohydrate is elongated, okay, hourglass appearance. So yan yung morphology ng ating monohydrate that is associated with your ethylene glycol poisoning. Okay, so yan. So ethylene glycol poisoning, saglit lang class ha, ayusin ko lang. Alright, so yan po. Alright, so in addition to that, in addition to your ethylene glycol poisoning, okay, so please also, yes, please also include under your monohydrates, okay, we have your methoxyfluorine toxicity. Okay, methoxyfluorine toxicity. Ayan. So yan, methoxyfluorine, fluorine toxicity. So actually, between your monohydrate and your dihydrate, ang nako-correlate natin in the presence of disease states or pathologic conditions ay yung ating monohydrates. Okay? So like for example, meron siya sa methoxyfluorine toxicity, meron siya sa ethylene glycol poisoning or toxicity, meron din po siya sa severe chronic renal disease. Okay, so siya yung mas nakakatakot na makita natin under the microscope as compared to your dihydrate. Kasi usually sa dihydrate naman, oxaluria lang yan. Okay, so yan po. And then, yan ka ng yan po, tas and then ka ng and then. Okay, sorry po. Alright. If for example, your calcium oxalate, okay, kasi dinidiscuss ko na din ang renal pathology. Tama, ayan, ine-incorporate ko na siya, okay, dito sa ating discussion ng sediments. Alright, so para at least mas maintindihan natin ang renal pathology. Okay, so ang CAOX po natin, alright, so if they are seen in clumps, okay, if they are seen in clumps under the microscope, so this is usually associated with the presence of your kidney stones. Okay, yan. So, you also have to report kung kunwari man na yung calcium oxalate na nakita mo ay in clumps kasi pwedeng merong kidney stone yung ating pasyente. Okay, so yan. So in order for you to at least appreciate the appearance of your calcium oxalate under the microscope, yes, of course, may ipapakita po ako. Wait lang kayo dyan. Okay, yan. Yan. Ayan, okay. So ito in clumps. 'Di ba? We have here your calcium oxalate in clumps. Okay? So in particular, envelope, ito yung tinatawag natin na yes, envelope shape. Okay? Ito yung tinatawag po natin na envelope shape. So calcium oxalate with dihydrate. So ito din, envelope shape din po ito, pero hindi siya in clumps. Okay? So pag in clumps, possible presence of your kidney stones. Okay? So yan. So ito naman po yung ovoid ba yung nakalagay? Okay. Ito naman po yung ovoid, tama. Ovoid, yes, form ng ating calcium oxalate. Ito yung hourglass appearance na sinasabi natin. Okay? So yan. Ay, sorry. Alright, so yan. So dumbbell, ito dumbbell or your hourglass appearance. Okay, so saan ulit ito nakikita? We have your ethylene glycol poisoning. Okay, so in general, yung ating monohydrate, whether it be your dumbbell shape or your hourglass appearance, both of them may be seen as a consequence of severe chronic renal disease or your methoxyfluorine toxicity. Si hourglass, specific po yan sa ating yes, specific talaga, ito naman sa specific, pero nakikita po natin yan sa ating ethylene glycol poisoning. Okay? So yan. So yan ang itsura ng calcium oxalate under the microscope. Alright, so next we have your monosodium urate. So your monosodium urate class, this is not common. This is an uncommon urine crystal that is seen in acidic urine. Okay, so they appear as colorless to light yellow, slender, pencil-like prism with blunt ends. So take note that your monosodium urate, this is soluble in alkali. Okay, so under the microscope, ayan, so pencil-like appearance under the microscope pero hindi patusok yung kanyang dulo. Kaya ang description dito ay blunt ends. 'Di ba? So kung babalikan natin yung description, slender, pencil-like prisms with blunt ends kasi hindi nga siya patusok. Okay, so yan. So this is your monosodium urate. All right? So remember, it is not common it is a crystal that is not common in urine. Okay, so another, we have your acid urate. Your acid urate naman, this is more common in old urine as compared to fresh one. So common in old urine. Okay, so they appear as yellow-brown balls or spheres that resembles your biurates. Okay, that resembles your biurates. Yellow-brown in color balls or spheres that resembles your biurates. Okay, so apart from that, they may appear as large granules and may have spicules, katulad ng ating biurate. Okay, so how are we going to differentiate it from your ammonium biurate? Of course, number one ay pH. Kasi ang acid urate, okay, ang acid urate po ay nasa acidic. Okay, nasa acidic pH po yan. Okay, o baka malito kayo ha, ma'am, akala ko ba common siya sa old urine? Eh di ba pag old urine, tumataas yung kanyang pH, nagiging alkaline siya. Okay? Meron naman pong instances na kahit na old yung urine natin, lalo na kung sobrang baba ng pH, like for example, pH 4, okay, hindi nagiging ganun ka-significant yung standing na nagiging alkaline. Okay, so pwedeng from 4, pH of 4, tataas siya sa 6, okay, which still is considered to be acidic. However, the urine is already old. Okay, nakuha, ayan. So, yes, so apart from, ayan, pH. So, yung acid urate natin, nakikita siya sa acidic pH. Yung atin naman pong ammonium biurate, nakikita po siya sa alkaline pH. Okay, so apart from that, we can also make use of their birefringence characteristic. So acid urate has a strong birefringence. Okay, and your acid urate is converted or may be converted to uric acid upon the addition of your glacial acetic acid. Okay, so that is for your acid urate. Ayan, acid urate. Okay, next, we go naman to the different crystals which are normally found in alkaline urine. So ano ulit yung rule natin when it comes to our crystals? Basta urate, uric acid, nasa acid, tama na, basta urates or uric acid, nasa acidic urine siya. Basta phosphates and carbonates, nasa alkaline urine siya. Okay? So ano yung exception dito sa rule na to? We have their calcium oxalate, which may precipitate in both acid and alkaline urine. Okay? Another exception is your ammonium biurate. Okay, ayan, ammonium biurate class. Ito lang yung merong urate sa pangalan niya na nakikita sa alkaline. Bakit siya sa alkaline urine nakikita? Kasi this is due to the presence of ammonium. Okay? Ammonium. Okay? Kaya siya yung mas nangingibabaw. Okay? When it comes to this particular crystal, that's why it is seen in alkaline urine. Okay, so yan. So we have amorphous phosphate, so on and so forth. So let us discuss these different crystals. So una, we have your amorphous phosphates. So hindi na ako naglagay ng microscopic yung image ng ating amorphous phosphates. Why? Kasi parehas lang naman po sila ng itsura microscopically ng amorphous urates. Okay, so yung may dumi-dumi, may dumi-dumi doon sa ating microscopic field or may mga granules kang nakita, amorphous phosphate yan or amorphous urate. Okay, so yung technique namin in the laboratory is, kasi hindi mo naman talaga sila madi-distinguish. Okay, tama. Yung based on their appearance. So, ang distinguishing factor na kino-consider namin ay yung pH. Okay? So, say for example, we are able to see granules, okay, granules that appear, amorphous granules rather, in the urine of the patient. Okay? We look at the pH. Okay, so kung ang pH ng urine sample niya ay alkaline, nire-report namin as amorphous phosphates. Kung kunwari naman yung pH ng urine sample ay acidic, nire-report naman namin siya na amorphous urates. Okay, so granular in appearance, similar to your amorphous urates. Okay, so it is soluble with acid and insoluble at 60 degrees Celsius as compared to the solubility characteristics of your amorphous urates. Okay, and apart from that, the color of the precipitate that is produced, we have white precipitates. Okay, white precipitate po yan sa ating amorphous phosphates. Okay, so another, we have your ammonium biurate. So again, tatandaan natin class, okay, wag ninyong kakalimutan na this is the only urate that is present in alkaline urine. So it has a dark yellow-brown color that appears as spheres with striations or spicules. Okay, so because of this morphology of your ammonium biurate, okay, one unique description which is given to the microscopic appearance of your ammonium biurate is that it has a thorny apple appearance. Okay, so it has a thorny apple appearance and it is soluble in acetic acid and heat. Okay, so it is soluble in acetic acid and heat. Saglit lang, class. Okay, it is, ayan. And apart from that, take note, okay, that the ammonia needed in the formation of your ammonium biurate crystals, this is provided or produced by urea splitting bacteria. So again, ano ang classic example natin or classic representative natin ng urea splitting bacteria? Okay, very good. So, ibig sabihin, pinanood mo na yung aking video on turbidity. Okay, so we have Proteus species. Okay, so we have Proteus species. Okay, so yan. So, this is a kind of bacteria that is considered to be urea splitting. Okay, thus you are able to produce ammonia, and this ammonia is needed in order for us to form your ammonium biurate. Okay, yan. So since kailangan ng ammonia sa production ng ating ammonium biurate, okay? So, the presence of this particular crystal is also associated with old specimens, okay? Old specimens po. Alright, so yan. So, of course, depende na lang kung may UTI yung pasyente, di ba? That is capable of splitting your urea, providing your ammonia. Okay, so yan. Pero common po siya na nagka-crystallize sa ating old specimens. Alright, so another characteristic of your ammonium biurate, it can be converted to uric acid with the addition of your concentrated hydrochloric acid or even your acetic acid. Okay, so ano na nga ba yung sinasabi natin na thorny apple appearance? Okay, so ito siya. Ayan. So, yan. Okay. So, we have the thorny appearance of your ammonium biurate. So, spheres with spicules. Diba? Spheres with spicules siya. Kaya, the term thorny apple appearance. Okay. So, next, we have your calcium carbonate. So your calcium carbonate naman, so this is colorless. Okay, they appear as colorless, tiny, granular spheres, often in pairs or tetrads. Okay, medyo maganda din ito under the microscope. Okay, apart from this particular morphology, your calcium carbonate may also appear as dumbbell. Okay, so meron din pong dumbbell forms ang calcium carbonate natin. Okay, and take note that since it contains carbonate, okay, so this is the only crystal that produces effervescence upon the addition of your acetic acid. Alright, and apart from that, as to its clinical significance, take note na ang ating calcium carbonate, it is associated, okay, with inorganic calculi formation. Okay, so calculi, so ito yung stones, mga renal stones po natin. Okay, so it is associated with inorganic calculi formation. Okay, so we have your calcium carbonate. Ayan, so ano yung itsura niya under the microscope? Okay, so ganito class ang itsura nila under the microscope. So we have spheres, di ba? So sabi natin, spherical in shape which may appear in pairs. Okay, like for example this one, ito, which may appear in pairs or in tetrads. Okay, so as you can see, medyo granular yung kanyang appearance as compared to the other crystals that we have. Okay, so again, do not forget, this is the only crystal that produces effervescence upon the addition of your acetic acid, and of course, it is associated with inorganic calculi formation. Okay, so next naman, we have your calcium phosphate. Your calcium phosphate class, okay, this is otherwise referred to as your apatite crystal. Okay, so in conjunction with, of course, magiging future RMTs tayo. Alam nyo sa board exam, ang ginagamit nilang mga terms ay yung mga trivial terms. Like for example, wedelite, wewelite, apatite, yan, yung mga yan. Favorite po nila yung mga ganyang terms. Okay, so please do not forget yung mga ganyang terms na binibigay ko ngayon. Okay, yes, maaalala nyo ako pag na-encounter nyo yan sa board exam. Okay, so yan, apatite crystal. So it is colorless, okay, and it is soluble in dilute acetic acid. All right, so take note that for your calcium phosphate, there are two forms of calcium phosphate which may be present in your urine sample. So we have the dibasic form. Okay, meron tayong dibasic form and your monobasic form. So depending on whether we are talking about the dibasic or monobasic, so your calcium phosphate crystal may appear differently. Okay, so they have different morphologies. So for our dibasic, this is more common. Okay, o yan, more common na naman tayo. Ito na naman tayo sa more common at saka less common or rare. Basta class, tandaan ninyo na pag may dye, okay, dye, lahat ng dye ay more common yan. O, parang doon sa ating calcium oxalate, di ba? Ang dihydrate ay mas common sa monohydrate. So dito naman sa ating apatite crystal or calcium phosphate, mas common ang dibasic as compared to your monobasic. Okay? So dibasic forms of calcium phosphate appear as thin prisms often in rosette formations or stellar forms. So yung ating monobasic naman, irregular or granular appearing in sheets or plates. Okay, so take note that your apatite crystal, when it comes to its clinical significance, this is a common constituent of renal calculi or renal stones. Okay, so yan. Soluble in dilute acetic acid. Okay. Alright, so ito ang itsura ng ating apatite crystal or ng ating calcium phosphate under the microscope. So ano ito, class? Anong form ng calcium phosphate to? Monobasic or dibasic? Okay, very good. So we have your dibasic. Kasi kung titignan mo, okay, merong thin prisms and they are arranged in rosette forms. 'Di ba pag sinabi mo class na rosette, para siyang bulaklak. Okay? Kaya nga rosette, okay? Basta pag na-encounter nyo yung term na rosette, ibig sabihin the appearance is flower-like. Flower-like, okay? Bakit kaya hindi lilet, 'di ba? Lily, lilet. Bakit kaya rose, rosette? Okay, hindi ko din alam. Bakit kaya hindi, ano pa ba yung mga flowers natin? Orchidet. Mga ganun. Hindi ko din alam. Hello. Okay, daisiet. Mga ganyan. Okay, so anyway, rosette. Rosette, flower looking siya. So naka-arrange siya ng ganun. Okay, so ito, hindi lang siya kompleto, pero still, it is made up of thin prisms. Okay, so both actually of this are your dibasic apatite or dibasic calcium phosphate. Okay, next naman po tayo, we have your triple phosphate. Ito, favorite din po nila ito sa board exam. Okay, so yung triple phosphate po natin, class, okay, this is otherwise referred to as your ammonium, magnesium, okay, phosphate. So this is the chemical name of your triple phosphate, ammonium magnesium phosphate. Ang trivial name niya ay struvite. Okay, yeah. So do not forget ammonium magnesium phosphate or otherwise referred to as your struvite. We have your triple phosphate. So they appear as colorless prisms with 3 to 6 sides or less commonly flat fern-like form. Okay. Alam nyo, class, another common description or term that is associated with the appearance of your triple phosphate is coffin lid. Okay? Tinatawag din po silang coffin lid crystals. O wag malilito ha. Meron tayong envelope crystals, 'di ba? So ano yung envelope crystals natin? We have your wedellite or your dihydrate. Ito namang si triple phosphate, coffin lid crystals naman po siya. Okay? So it is soluble in dilute acetic acid. And when it comes to its birefringence, it is moderate. Okay? The presence of your triple phosphate, suggests urine stasis in the kidney as well as in the bladder. Okay? Yes, suggests urine stasis in the kidney and your bladder. So it is commonly seen in highly alkaline urine. Okay? Yes. So ibig sabihin, this is also a crystal that is associated with your urea, okay, splitting bacteria. So ano na ulit yung isang crystal that is associated with the presence of your urea splitting bacteria? Okay, very good. We have your ammonium biurate. So another is your triple phosphate. Okay, ayan. Actually, when it comes to the clinical significance of your triple phosphate, since its formation indicates urine stasis in the kidney as well as in the bladder, very common din po siya or nagkukos din po siya ng renal calculi formation. Okay, it also causes renal calculi formation or yung formation ng ating kidney stones. There is a particular kidney stone that is associated with your struvite or your triple phosphate, and that is your Okay, wag kakalimutan ha. Ayan, wait lang. We have your Staghorn calculi. Okay, so we have your Staghorn calculi. Yes, SS lang yan. So, Struvite Staghorn calculi. Okay, so yan. Kung i-google ninyo, pero baka mamaya hindi nyo i-google. Okay, so anyway, ang term na Staghorn calculi, okay, this is due to the appearance of the renal stone. Kasi if you're going to look at the formation of your Staghorn calculi, di ba doon sa ating kidneys, meron tayong mga minor calyces, tama? May mga minor calyces tayo, which will, ang pangit. Okay, yan. Okay, which will eventually merge to form your major calculi, so on and so forth, 'di ba? Bago ka magkakaroon ng renal pelvis, so kunwari, yan yung kidney mo. Okay, sorry sa drawing ko. Okay, yan yung kidney mo. So we have your minor calyces, your major calyces, and then your renal pelvis, and then your ureters. Okay? So saan na-form ang Staghorn calculi? Doon sa mga calyces natin. Kaya nga siya tinawag na Staghorn kasi mukha talaga siyang horn. Okay? So pwedeng ganyan ang itsura niya. Basta mukha po siyang horn. Okay, so kung ano yung itsura nung calyx or calyces rather, kung saan siya na-form, ganun din ang itsura niya. Thus, the term Staghorn calculi. Okay, mukha po siyang horn. I think meron akong provide na picture ng Staghorn calculi doon sa renal calculi class, doon sa module ninyo. Okay, so kindly check na lang. Alright, so those are the things that you have to remember for your struvite, your triple phosphate, or your ammonium magnesium phosphate. So ano yung coffin lid appearance ng ating triple phosphate? So ganyan po. Okay, so yung ating namang envelope appearance ng CAOX, ganyan naman siya. Diba? Ganyan. Okay, so ito ay coffin lid appearance, okay, of your triple phosphate. Alright, so those are the different normal crystals in your alkaline urine. Okay, so now let us move on to the abnormal crystals seen in your acidic urine. So actually, wait lang. Wait lang. Alright, so yan. Sige, let's continue. So, these are naman abnormal urine that is, abnormal urine, ito, hindi ko naman siya na-edit. Okay, abnormal crystals which are oftentimes seen in acidic urine. Rarely po siyang nakikita sa neutral or even your alkaline urine. Kaya, nilagay ko na dyan na acidic urine para at least matandaan po natin. Kasi if I'm not mistaken, doon sa ating doon po sa ating module, ang nakalagay dyan ay abnormal crystals. Okay, hindi. Nakalagay naman pala yung pH. Okay, so take note na acidic urine usually ang kakakakitaan, tama ba ako, ang pH ng urine sample natin at which you are able to see these different abnormal crystals. Okay, so we have your cysteine, cholesterol, tyrosine, leucine, bilirubin, sulfonamides, ampicillin, indinavir sulfate, and your radiographic contrast media. Okay, or dye. Alright, so first we have your cysteine. Okay, so your cysteine, this is colorless. They appear as colorless hexagonal plates, okay? And they are soluble in ammonia and dilute hydrochloric acid. So your cysteine, ang clinical significance niya is it is associated with cystinuria or cystinosis. Okay, so apart from that, your cysteine, it has been associated with your Fanconi's syndrome. Okay, so yan. So those are the different clinical significance of your cysteine. And if it is present in your urine sample, dapat hanapin mo yung sulfur odor. Because take note, yung cystinuria natin at saka yung cystinosis natin, they are associated with a characteristic odor of your urine sample, and that is your sulfur odor or your rotten egg odor. Okay, sulfur odor or your rotten egg odor. All right. May I just also, kasi wala lang. Gusto ko lang din na alam ninyo yung difference ng cystinuria. Okay, cystinuria from your cystinosis. Magkaiba to class ha, magkaiba po silang dalawa. Okay, so pag sinabi po natin na cystinuria, okay, cysteine appears in the urine because there is something wrong with the reabsorption of your amino acids. Okay, so defect in the reabsorption of amino acids. So in particular, ang amino acids po na hindi nare-reabsorb ng ating renal tubules, we make use of the mnemonics COLA. Okay, so COLA stands for cysteine, ornithine, lysine, and arginine. Okay, so COLA stands for cysteine, ornithine, okay, lysine, and of course your arginine. Okay, ayan. So, a good example of a condition which affects the reabsorption of substances in the renal tubules is your Fanconi syndrome. Okay, yes. Si Fanconi syndrome, one of its manifestations is cystinuria. Nakuha? Yes. Kasi sa Fanconi syndrome, nagkakaroon ng defect in the reabsorption, actually not just of your amino acids but of essential substances in general. Okay? So yan. So ma'am, ano naman po ba ang cystinosis? So when we say cystinosis, systemic po ito. Okay, in which there is a deposition, okay, there is a deposition of cysteine in many areas or tissues of the body. Okay, in many areas or tissues of the body. Alright, so yan naman ang cystinosis. So since nagkakaroon ng deposition ng cysteine, so some of it will be present in the circulation, and of course, they will be excreted out as part of your urine. So ito ay parang leakage or overflow from the high levels of cysteine in the circulation. Thus, they will be excreted out as part of urine. Hindi naman po lahat kasi sa sobrang dami ng cysteine na ma-filter out, hindi lahat ay maibabalik sa circulation. Hindi lahat ay mari-reabsorb. Okay? Some of the cysteine will be excreted out as part of your urine. Okay? So there are two tests that we can perform in order to determine the presence of cysteine in urine. So we have your cyanide, nitroprusside reaction, and your Sullivan tests. Okay, so those are the things that you have to remember for your cysteine. So under the microscope, it will appear like this. Okay, so hexagonal, colorless hexagonal plates. Okay, so we have your cysteine. All right, so another, we have your cholesterol. Okay, so your cholesterol, it has a colorless, flat, rectangular, or they appear rather as colorless, flat, rectangular plates with notched corners. Okay, so other descriptions that are used in order to characterize the appearance of your cholesterol, we have, okay, staircase pattern. Yan yung mga ginagamit po to describe its appearance. Or they may appear as broken window panes. Okay, so they may also appear as broken window panes under the microscope. So do not forget the appearance of your cholesterol. So take note that your cholesterol, it is soluble in chloroform and ether. And again, ano ang kanyang clinical significance? Lagi ko ngang sinasabi to class lipiduria and conditions, okay, which are manifested as lipiduria. So we have nephrotic conditions, lipiduria, and lipid necrosis. Okay? So para mas ma-appreciate natin yung appearance ni cholesterol, ganito po siya under the microscope. Okay? So we have here, okay, so nakita naman ninyo, yan. So, ano ang kanyang appearance? Rectangular plates with notches. Diba? Ayan, may mga notch po siya. Okay, ayan. 'Di ba? Yan, with notches. And then, staircase pattern kasi nga, yan, parang ganyan. Staircase pattern, ito. Ay, sorry. Ayan, ito, parang staircase pattern po siya or broken window pane. So, para siyang basag na glass. 'Di ba? Glass windows. Alright, so that is your cholesterol. Malapit na class. Okay, next we have your tyrosine. So tyrosine, they appear as colorless to yellow fine delicate needles. Ayan, fine delicate needles which are usually arranged in clusters or sheaves. Okay, which are arranged in clusters or sheaves. Okay, ayan. So they are soluble in alkali or heat, and clinical significance po niya, it is noted in liver disease as well as aminoaciduria. Okay, so para lang po matandaan natin the different crystals that are associated with liver disease, ano yung ating palatandaan or mnemonics? We have LTB or La Trinidad Benguet. Okay, so do not forget La Trinidad, okay, La Trinidad Benguet or your LTB. So ano yan? L stands for leucine. Okay, L stands for leucine. T stands for tyrosine. Okay, tyrosine, and of course B stands for bilirubin. So these are the crystals which are associated with liver disease. So do not forget La Trinidad Benguet, LTB, leucine, tyrosine, and bilirubin. Okay, so it may also be, kung kunwari man na tyrosine lang ang nakita mo, it may be indicative of an aminoaciduria. Okay? So ito yung sinasabi natin na fine delicate needles in clusters or sheaves. Okay, so fine delicate needles in clusters or sheaves. Okay, so yan, tyrosine. Alright, another, we have your leucine. Okay, so they appear as dark yellow to brown spheres which resemble fat globules with delicate radiating and concentric striations. So actually, ito yung ito yung very noticeable under the microscope, the concentric striations of your leucine. So they are soluble in hot alkali or alcohol, and again, clinical significance, huwag kakalimutan, liver disease, La Trinidad Benguet, LTB. Okay, we have leucine, tyrosine, and bilirubin. Okay, so kung present man siya na mag-isa, so it is associated also with your aminoaciduria. Okay, nagmamadali si ma'am kasi kakain na kami. Okay, yan, 'di ba? So, very very distinct yung kanyang ano yung tawag doon? Ay, nakalimutan ko yung term, concentric, sorry. Nakalimutan ko yung term, concentric striations. Okay, so meron siyang, 'di ba ganyan siya, tapos meron siyang concentric striations. Okay, parang sa puno. Okay, so we have your leucine, okay, under the microscope. Alright? Next, we have your bilirubin. So again, anong hindi natin kakalimutan kay bilirubin? La Trinidad Benguet. Okay? Leucine, tyrosine, and of course, bilirubin, liver disease. Okay? So they appear as yellow to ruby red, and they are usually in clumps. Okay? Clumps of needles or granules. Pero usually clumps po siya, needle clumps. Ayan. So do not forget ha, ruby red under the microscope. Yellow to ruby red under the microscope. So it is soluble in acetic acid, hydrochloric acid, sodium hydroxide, ether, and even your chloroform. Okay, so bilirubinuria associated with liver disease or even obstruction. So kung mag-isa ng bilirubin crystal mo, so of course, that's obstruction. Kasi pag liver disease, ano ulit ang palatandaan natin? La Trinidad Benguet. Okay? LTB. Naku ha? Ayan. Ayan po. Alright. So, under, bakit napunta siya dyan? Alright. So, another. Yan. Yellow to ruby red. Yan. Clumps. Needle clumps. Okay? So, we have your bilirubin. Next, we have your iatrogenic compounds. Okay? Or your medications. So, take note class na usually kasi, kaya nagka-crystallize yung ating mga medications or iatrogenic compounds, this is due to inadequate patient hydration. Okay? So kung kunwari man na well-hydrated naman yung patients, ayan, walang problema. Hindi magka-crystallize yung ating iatrogenic substances or yung ating mga medications. So usually, nagka-crystallize lang sila kung hindi umiinom ng tama yung umiinom ng tubig ha. Okay, hindi umiinom ng tubig yung pasyente natin or yes, wala siyang proper hydration. Okay, so your sulfonamides, ayan, so they appear as yellow-brown and actually the appearance varies depending upon the type of sulfonamide that we are talking about. Okay? So, meron po kasing dalawang types ng sulfonamides which may precipitate. So, first, we have your sulfa-methoxazole. Okay? That's the first one. We have your sulfa-methoxazole. And then the other one is your acetyl sulfa diazine. Ayan, sulfamethoxazole, and then the other one is acetyl sulfadiazine. Okay? So yung ating sulfamethoxazole, so they usually appear as spheres. Ayan, they usually appear as spheres with striations, okay, or dense globules. Okay, so yan. Ay, dito na lang sa baba, class. Okay, so your acetyl sulfadiazine naman, they usually appear as sheaves of wheat with eccentric, okay, with eccentric binding. So another, they have been described also to have fan forms. Okay, so fan forms or sheaves of wheat. Okay, fan forms or sheaves of wheat. Okay, ayan. Ayan, all right. So in order for us to determine for the presence of sulfonamide crystal, so there is a particular test. We have your lignin test in which we make use of the reagent 25% hydrochloric acid plus of course your urine. Okay, so the positive result for your lignin test is of course the formation of a yellow-orange color. Okay, so yellow-orange color lignin test. Okay, for your sulfonamides. All right. So, yes, ano ang itsura ng ating sulfonamides under the microscope? So actually, itong ipapakita ko sa inyo ay si acetyl sulfadiazine. Okay, acetyl sulfadiazine, so we have sheaves of wheat. Okay, sheaves of wheat appearance. All right, next we have your ampicillin. So your ampicillin, it appears as colorless, needle-like sila. Okay, fine needle-like appearance. And the crystallization of your ampicillin is enhanced upon refrigeration. So pag ni-refrigerate mo yung sample at meron siyang ampicillin, so pwedeng mag-aggregate yung ating ampicillin crystals, forming now your bundles. Okay, so this is a consequence of ingesting massive doses of penicillin without adequate hydration. Ayan. So itong sample na to, refrigerated siya kasi you would be able to see rather bundles of your ampicillin crystals. Okay? Yan. So next, we have your indinavir sulfate, one of the hindi naman. Yeah. Maganda siya under the microscope. Okay? Indinavir sulfate. So they appear as colorless or gray-brown, slender, feather-like crystals that aggregate into wing-like bundles. Okay? Natanong na ito sa board exam. So sabi nila, ano daw yung crystal na pwedeng makita sa isang HIV patient or sa isang patient suffering from AIDS? Ang correct answer ay indinavir. Okay, so para mas madali po natin siyang i-memorize, underline nyo yung letter V kasi it is associated with antiretroviral therapy, HIV. Okay, ayan. Okay, yan. Para mas madali nating i-memorize. So, asan yung sinasabi mo, ma'am, na feather-like crystals na na-arrange sa wing-like bundles? Ito siya. Oh, di ba? Para siyang feather. Okay? And then, syempre, pag pinagsama mo si feather, magiging wing-like yung kanyang appearance. So, di ba? Wing-like naman talaga siya. So, do not forget ha, antiretroviral therapy, indinavir sulfate, HIV or AIDS patients. Okay? And then last na ito, I think. Last! Yes! Okay, we have your, sorry, excited ako. Radiographic dye. Okay, this is colorless and highly birefringent. And sabi sa ating libro, hindi ko nga din maintindihan kung bakit sinabi na ganon. Okay? Sabi sa mga libro natin, it resembles your cholesterol crystals. Okay? Yan. Pero, parang hindi naman. Okay? Parang hindi naman, 'di ba? Siguro kasi mukha din siyang sometimes they may form yung rectangular, 'di ba? Medyo hindi kasi needle-like yung appearance niya. Pero 'yun ang sabi ng ating mga references, it resembles daw your cholesterol crystals. So how are we going to differentiate it from your cholesterol crystals? Okay, of course, unang-una, lalo na kung wala ka namang ibang pwedeng gawin, di ba? To differentiate them, ang pinakasimple is to look for the specific gravity. Okay, so tingnan mo yung specific gravity ng sample mo kasi pag radiographic dye yan, usually very high ang kanyang specific gravity. Diba sabi natin, greater than 1.040. In some references kasi, ang nakalagay ay greater than 1.030 or even 35. Okay? Basta alam natin na pag hindi physiologically possible yung ating specific gravity, masyado siyang mataas, ibig sabihin, meron pong radiographic dye. Okay, doon sa ating urine. And this may also indicate the possible presence of your radiographic dye crystals. Okay, so apart from that, kung titingnan naman natin yung sa side ng cholesterol, okay, so of course, we still follow yung ating confirmatory procedures, which is the use of your polarizing microscope, okay, and your lipid stains, okay, your lipid stains. And of course, alin ang magpa-positive in our polarizing microscope and your lipid stains? We have your cholesterol crystals. And your radiographic dye will, of course, not be positive in both techniques or procedures. Okay! Yay! Yes! Tapos na sa wakas ang ating microscopic analysis. So class, I hope the videos that I provided will help you, yes, in your review, particularly for the laboratory. Particularly for the laboratory. Okay? So, thank you so much. Mag-aral po kayong mabuti para mataas po ang makuha natin sa exams. Okay? So, I'll see you again. Yes, hello, good night, good afternoon, good morning, pahinga ka muna, and then review ulit. Okay? So, bye!